I'm here today with David, who came to our office back in October 1st because he was suffering from serious degeneration in the hip. And if you can refresh my memory, Dave, I believe you were saying that you were contemplating the total hip replacement. You told you needed one.
I looked into it because I didn't know what else to do.
What were you, tell us what you were having. What was your problem?
Oh, just chronic pain in my hip.
How long had you been dealing with it?
Started probably like maybe 8 years.
8 years ago?
And it just kept getting worse and worse and worse. From my other job, I walked all day long, just constantly walking, treating lawns. So it was, you know, it wasn't just loping along, it was quick pace, walking and walking.
Mm-hmm. And I remember seeing you over the last few months, before we did the treatments, that you were progressively getting worse, and your pain level was about...
it was up there 9.5.
9.5 out of a 10.
Yeah, it was bad. I could hardly walk. I couldn't walk straight.
Mm-hmm.
I was all bent over to my right side, and chronic pain, constant pain.
So you learned about the treatments that we did in this office with allograft injections containing stem cells, and you had that procedure done on October 1st. Okay. And this is, today's date is February 4th, 2020. How much improvement have you had since that procedure?
Oh, geez, phenomenal. And it was almost immediate. Within a week or two, I had already noticed the difference. Part of it was psychological, and I felt better.
Mm-hmm.
Plus all the work you did on my hip.
With the follow-up care that we did for it, yes.
And yeah, I noticed the change immediately.
So your pain was about a 9.5 before we did the procedure. What would you say it is today?
In my hip?
Yes.
Well, I'm still having trouble with my knee, so sometimes it's hard to judge. But as far as the hip, it's nothing like it was. When I experience pain on my right side now, I know it's coming from the knee.
And we didn't do the procedures to the knee, which only to the hip at the time.
Just the hip. Yeah.
Right. Okay. But now you're wanting to have it done to the knee since the success you've had with the hip.
Yeah.
Correct.
Yeah.
How's it improved the quality of your life? How does it affect you?
It's 100% different.
100% different?
Yeah. Yeah, I'm not in constant pain anymore, and I'm walking straighter now.
Upright, yes. You were really hunched over to the side before.
Yeah. Yeah, and everyone was, oh, why are you limping? What's the matter with you? And it's like, it ain't that bad, is it? It's not that bad. I guess it was that bad.
It was pretty bad. Was the procedure painful or uncomfortable for you in any way? Or any of the follow-up sessions that we did here?
No. Nope. No, I was really surprised. Well, I had seen your video when you had the procedure done. And, you got through it okay.
I did. Thanks.
Because I was watching the expression on your face when she put the needle in, and it wasn't shocking to you. Yeah, no reaction. So.
And is this something that you would recommend to anybody else having this procedure done?
Absolutely.
Were you surprised overall at the results?
Absolutely.
Okay.
Yeah.
All right.
I was quite impressed.
Okay. All right, Dave, thank you for coming in and telling me your story. Appreciate it.
Thank you, Brian.
Okay.